So plantar fasciitis is typically resulting, it starts as acute and then can become chronic and can actually last for several months, even to up to 2 years, which the literature shows can be self-limiting, but who wants to live with it for 2 years? So it's often as a result of some changes in mechanics. So sometimes as a result of an increase in body mass, or some foot or knee mechanics that are resulting in increased tension on the tissue. So when someone is in pain, it's actually pretty obvious. They're going to walk a little bit offset, so their symmetry is going to be different. They're not going to walk as fast, so they're not going to want to spend as much time in contact, so there'll be reduced contact time on that particular side. So we'll see a reduction in the symmetry characteristic, which is the contact time. Speed, because they're just not going to be able to ambulate as quickly for a couple of reasons. One, they don't want to spend much time in contact, and two, as they go into the propulsion phase, as we see down here in the lower right hand corner, they're not going to want to push off as much either and put excessive stress on that. So they don't want to go into extreme ranges of motion either in heel strike or in plantar flexion and use their gastroc-soleus complex too much. You may actually see also strategic change to using more hip flexion than plantar flexion during that propulsion phase. What you're also potentially going to see, if it's not specifically related to the foot pain, in other words, they're dealing with it, or it's at the earlier phases or the later phases, is making sure that we correct some of those abnormalities in the mechanics, so such as increase in pronation, so they go into a much more flat foot position, and that really is going to increase the stress on the calcaneal tendon. So you can also see some co-commitment issues with Achilles tendinopathy. And so we would want to look at the pronation supination to make sure there's not excessive angulation in the foot, especially on heel contact, or excessive pronation as they're going through that gait line. So looking at the pronosupination will give us some indication as they're over pronating or over heel everting, putting too much stress on that tissue and really flailing that out.